Hi, I'm Janelle NANOS, business reporter with the Boston Globe, and this is Bold Types, conversations with Boston's business leaders. Today, we're sitting down with Andrew Dreyfus, CEO of Blue Cross Blue Shield, Massachusetts.
My father was a property and casualty insurance agent in Boston. He was best known for being one of the only, if not the only, white insurance agencies that could find insurance for African-American owned businesses in the South End, Roxbury, and Dorchester. So when I was in high school, he would come visit his customers on the weekend. And one of the spots he'd love to take me was right here, and this was called the City Hospital Pharmacy.
What period was this?
So this was
not to
like,
totally age you, but
no, that's okay. This would be like in the early 1970s.
Okay.
And when I graduated from college, my first job out of college was at the South End News. I wrote the paper, I edited the paper, I laid the paper out, and I also had the privilege of delivering the paper. The South End was a great community to be an editor in the early 1980s. This was a community that went through a lot of urban renewal.
Sure.
There was a lot of controversy about the kind of gentrification in the neighborhood. And you would, as you still today, have kind of expensive condominiums, across the street from subsidized housing. And so you have one of the few neighborhoods in Boston where there's a great mix of kinds of people, different races, different religions.
As we move towards Mass Ave and closer to Boston Medical Center and all of the sort of, thoroughway there where we sort of, I think of as opioid row. I mean, one of the biggest issues that is facing us nationally here in Massachusetts. I know you've been working on this issue from various ways, and I was hoping to talk to you a little bit about what you're seeing now in terms of changes.
Mental health and addiction have for too long been kind of the stepchildren of the healthcare system. And we have to bring them into the mainstream. And we have to start to treat, for example, addiction for what it is, which is a chronic illness like heart failure or diabetes. And so we would never deny a diabetic their medication, their insulin. In the same way, we shouldn't deny any person, for example, with a opioid addiction, the necessary treatment.
We're obviously dealing with the opioid crisis right now here in Massachusetts, but as we look forward, what are the challenges that you see on the horizon that you are, really kind of most worried or concerned about? Baby boomers are getting older.
Well, one of the big things 5 and 10 years is that the genetic research that is being led in part here in Boston at places like the Broad Institute and others is going to change medicine. And increasingly, medicine is going to be personalized. So it won't be just patient, it will be what does your genetic code tell you about how we're going to treat your disease. You
started your career at Blue Cross Blue Shield on the foundation side and eventually became CEO. You were proposing a concept that was essentially what is now the term is universal health care, right? So Massachusetts was the prototype for the country. The Affordable Care Act is now, Obamacare as we know it. I'd love to kind of go back with you and actually, talk with you a little bit about what it was like to be that disruptive at that point in time and to watch that evolve and become a national policy.
Well, so Massachusetts had for several decades been debating how do we fill the gap. We had about 500,000 people in Massachusetts with no health insurance, and it was some ways unacceptable from a social policy perspective. But we had been never able to kind of close the gap. We called it the roadmap to coverage, and gathered all the groups together, the consumer advocates and business groups and hospitals and physicians, and got together and say, can we together think of a plan that will allow us to close this gap and make Massachusetts the first state in the country that has achieved close to universal coverage. We accomplished it, and it was really extraordinary, and it became the model for the Affordable Care Act nationally. And it gave people in Washington hope that it could be done, because this was seen as just an intractable problem. One of the things we've done over the last year or two is sat and talked to our members about what they want from us. So rather than us deciding what's in our members' best interest, we've listened to them. And it's been very interesting what we've heard.
Any interesting insights?
Yeah, so one really important insight is while our members really appreciate that we focus on wellness and we give them discounts on gym memberships and flu clinics and all that, what they really told us is they really want our help when they get sick. And what they want is an ally. They want someone that could help them navigate the healthcare system that is complicated, expensive, sometimes even feels hostile to their needs. So we're increasingly developing programs that do just that.
You mentioned the idea that you're sort of testing some of these ideas internally and you know, within the organization. And I know that you're doing that on several fronts, one of which is, you know, sort of ensuring that diversity is represented within Blue Cross Blue Shield. Talk with me about some of the diversity issues that you've taken on.
More diverse and inclusive organizations will be more successful. And so it's partly taking that message to the whole company so that everyone embraces it. Then it's very important to send a signal from the top. So our board and the chair of our board and the vice chair of our board are women. More than half our board are women and people of color. The same is true for our senior management leadership. And so that sends a message to the whole organization. But representation, having diverse representation, is really the beginning of the journey. We've now started to think more about what does it really mean to be inclusive? How do we bring diverse voices to every single issue? And so it's a journey, but we've made a lot of progress. I think it makes us a better company. By no means are we where we need to be,